Healing Perspectives lecture brought to you by the Sutter Health Institute for Health and Healing, the IHH. I'm Dr. Nadine Aldahan, and I am the medical director for the IHH clinics in San Francisco and Santa Rosa. Today's event is made possible by Sutter Health and generous philanthropic support from our community. Thank you. Today's presentation is recorded and will be available on our YouTube channel within a couple of days. You'll get a link as part of our post-event email. You will also receive a survey at the end of the presentation, so please share your feedback with us. Before we get started, I want to go over quick housekeeping to help prepare you for this insightful discussion. Please note, today's lecture is for informational purposes. Everyone's situation is unique, and we ask that you seek professional advice for your specific medical needs. Next, let's review how to use the Zoom functions to ask questions and get technical support from our team. This is an interactive lecture. You will not be on camera, and your questions and comments will not be visible to others due to HIPAA compliance, but we do encourage you to participate in the lecture. So there will be polls that appear on your screen to respond to. There's a chat icon on the bottom bar of your screen. It's disabled at the moment, but will be turned on when our speakers ask questions. You can click on the Q&A icon if you have questions for the speaker or for our team during the presentation. Our team is monitoring your questions and will try to respond to as many of them at the end of the presentation. If at any point you're having a hard time hearing or seeing anything during the talk, try to refresh your screen, check your internet settings or connection. If you need additional help, use the Q&A icon and our team will help troubleshoot. Now that we've covered the housekeeping items, I want to tell you more about the Institute for Health and Healing. We offer integrative clinical care to serve the whole person by combining the best of conventional medicine with proven healing practices from around the world. We have integrative medical clinics in San Francisco, Santa Rosa, Roseville, Sacramento, and San Carlos that offer the services listed here. Many of our services are covered by insurance. So please visit our website, scan the QR code for more information and to see our events calendar. The IHH hosts free events like this throughout the year with top medical practitioners. Now it's my privilege to introduce today's speaker, Dr. Matt Willis, and moderator, Dr. Aparna Dandekar. Dr. Willis is a physician and epidemiologist who's dedicated to the health and well-being of communities. He is the author of the California edition of Your Local Epidemiologist, which is a weekly public health newsletter. He was also a public health officer for Marin County for 12 years, elevating climate change as a public health crisis and leading strategies to build resilient neighborhoods. In addition, he has served as the Director of Primary Care on the Navajo Nation and as an Epidemic Intelligence Service Officer at the Centers for Disease Control and Prevention. Welcome. Dr. Aparna Dandekar is a board-certified family practice physician and certified Ayurvedic practitioner. She sees patients at our IHH clinic in San Francisco, where she blends the ancient wisdom of Ayurveda with modern medicine and osteopathy. She is passionate about holistic self-care and has an emphasis on breath work with great results. Now, it's my honor to welcome Dr. Willis and Dr. Dandekar.
Welcome, everyone. I am so excited to be here having this conversation with Matt. Before we begin, I'd like to start out with a brief overview with Matt about what climate change is and why we're going to talk about it. And Matt, can you kick things off for us?
Yeah, thanks so much, Nadine and Aparna. It's exciting to be here with you. And thanks everyone for joining. This is, I think, one of the most important conversations we would be having when it comes to our health and well-being. And I want to thank Sutter and the Institute for Health and Healing for setting this table and inviting me. So let's start with the definition. We all might have different ideas about what climate change actually means. For this conversation, we're defining it as the warming of the planet due to the accumulation of greenhouse gases and the related environmental disruption that affects our bodies and communities. And let's get some numbers to that. This slide represents global temperatures over the past 150 years, with zero representing the temperature around 1910 average temperature. And you can see, especially over the past 50 years, a steady increase on average temperature of more than 1.5 degrees centigrade or 2.7 degrees Fahrenheit. So while not everyone necessarily agrees to why this is occurring or the contributions of humans, there's no doubt that we're seeing a rise in global temperature just over our lifetimes. So if you were born in the 1980s or earlier, which is a lot of us, including me, we live in a world that is about on average 2 degrees warmer than it was when we were kids. Now, there's an important caveat here. My climate research has focused on modeling the health impacts of climate change into the future. And along the way, I've learned that there's a wide range of predictions of how fast the planet is warming and what it will do. So honestly, we don't exactly know what to expect. And many of the messages we receive are kind of worst case scenarios. In this presentation, I'm hoping to strike a balance. What can reasonably assume about the threat of climate change based on what we know now without being overly reassuring or overly alarmist. So let's just step back and have a brief refresher on the cause of climate change as we've defined it. I always picture those images of the Earth from the moon, those early Neil Armstrong pictures with this little beautiful blue gem kind of hanging there in space. And the temperature in that dark space around the Earth is about negative 400 degrees Fahrenheit. And luckily, we have this amazing atmosphere that protects us by collecting and keeping the energy from the sun. So on the left there, you see this blanket of insulation is made of greenhouse gases like carbon dioxide released from the breakdown of living things that's been in balance over millions of years. So greenhouse gases are good and necessary and natural. The problem is this. Over the past few decades, we're making too much of them through accelerated breakdown and waste, especially fossil fuels. On the right, you can see that this slide shows we're literally trapping heat in our atmosphere and it can't escape. So our big goal in addressing climate change is really one of restoring balance. The Earth is a biological system, an organism that people sometimes call Gaia, and it needs rebalancing, which is a concept that I think comes naturally to those of you in integrative medicine. And sorry, I'm advancing.
Uh,
There you go, Park.
thanks for that, Matt. One thing, that was a great overview. One thing that I've heard you say in the past, and something that stayed with me, is that in your line of medicine, in your specialty of medicine, the community is the patient. So, and I just love that. That really stuck with me. How does that statement connect to climate change?
Yeah, that's a very kind of public health perspective, is that the patient is really seen as the community as a whole. And it really comes from the reality that our health is primarily determined by the conditions in which we live. Our environment, speaking broadly, our physical, social, economic environment really determines what we're exposed to and the opportunities we have. In public health, we say your zip code is more important in terms of determining your health than your genetic code. And we see that in so many ways. In Marin County, where I was health officer, we had a 15-year difference in life expectancy. That is how long people can expect to live on average between Ross, one of our more affluent communities, and just a few miles away in Marin City, one of our less affluent communities. So I see life expectancy in that sense as a vital sign of community health. Just like I use blood pressure as a primary care doctor with my patients, as an epidemiologist, we look at patterns of disease, like rates of cancer and infections, in order to diagnose threats to community health and well-being. And climate change is really the ultimate shared environmental threat, and it's impacting all of us. And when the threats to our health emerge from our environment, the solutions are naturally upstream, right? We're not going to treat our way out of this on one-to-one patient visits. The community, the environment is our patient and requires care. So really public health at its core is the science of creating conditions for healthy living.
That's wonderful.
And
oh, go ahead, Matt. Did you want to add something to that?
I was going to say, I think we have a question for the audience now.
Oh, yeah. Yeah. So we want this to be interactive and engaging. So here's a question for you all. Yeah. So what climate health impact have you personally experienced in the past year? Wildfire smoke, I think a lot of us here in California, extreme heat, evacuation or preparation for evacuation, flooding, climate anxiety or stress. So I'm curious to see what you guys are seeing. I am on my end not seeing your guys' answers. Let me see if I click on something. Oh, here we go. Thank you. Yes, maybe that was giving you some more time here. Oh, yeah. So 58% of you said wildfire smoke. 50% of you said extreme heat. 9% said evacuation or preparation for evacuation. 6% said flooding. And 57% said climate anxiety or stress. So that really tells me, it's interesting to see your answers. It really shows me how important today's conversation is with you, Matt. And I just wanted to add here that none of us is immune to climate change. So myself as an integrative Ayurvedic, as an integrative physician who focuses on Ayurvedic medicine, which some of you may know as a traditional way of practicing medicine that goes back thousands of years in India. I teach my patient the Ayurvedic system, which relies on natural rhythms, right? So, for example, we follow certain seasons and certain routines, diet, lifestyle, exercises based on these daily and nocturnal, diurnal, and seasonal cycles. So with climate change, we see a shift in seasonal patterns and even like light pollution, right? We see that affects our daily rhythms. So I'm really interested in learning about how ancient traditional medicine practice, not just Ayurveda, but from around the world, how these practices adjust to our new climate, right? That didn't exist when these systems were created. For example, like some herbs, they no longer grow in their former geographic regions. These are ancient ethnobotanical practices now that are disrupted or they're grappling with climate change. So Matt, can you speak to this as a physician who also happens to have an academic background in anthropology?
Yeah, I think for me, one of the aha moments around understanding the reality of climate change as something that was impacting our health now was actually about 20 years ago. My first year as a primary care doctor on the Navajo Nation from one of my older women patients. She was very traditional, spoke only Navajo, needed an interpreter. She was an elder in the community, respected, and lived in a remote place called Narrow Canyon that had water running year round. And they would grow corn there. And corn pollen is an important and sacred thing in Navajo traditional ceremonies. And she told me for the first time in her life that the life of her ancestors, that the river was dry in the summer and the corn wouldn't grow. And she attributed the illness that she was experiencing and to her own children's illness to this loss. which I understood and was explained to me as a loss of what is called Hojo, which is a particular Navajo concept. It takes into account beauty. It's a word that means beauty, it means balance, it means harmony across both physical and spiritual ways. And in that tradition, where the health of the land and the people are the same, the disruptions of climate change are felt early and strongly. And there's a wisdom there to pay attention to. And it really kind of opened my eyes to this reality. And since then, I've been doing much more sort of scientific research on this subject as an epidemiologist and using artificial intelligence and large data sets to understand the impact of climate change. But that first experience, I think, remains really vivid for me.
Yeah, that is really interesting. The time that you spent on the Navajo Nation and being sort of what's the word I'm looking for? Immersed in these traditional cultural practices and seeing firsthand how these ancient practices are being impacted. I was wondering, Matt, what you think about us in Northern California. I know there's people joining from all over California, but why should we in Northern California pay special attention to climate change?
Well, California as a whole and Northern California included are, kind of a microcosm of the global impacts of climate change. We're seeing, we have a kind of a traditionally temperate environment that is getting more extreme. We're seeing the impacts of heat, wildfires, drought, flooding from both coastal areas and sea level rise, and inland from rivers, and increases in insect populations. So we're also relatively well resourced, relatively science-minded compared to other states in the United States. And we can bring awareness and solutions to places that have more barriers to action, whether those barriers are political or economic. So these are the primary threats that are facing us in Northern California. Um, in fact, we can't do a deep dive into all of these this hour. In fact, this is one of the primary challenges to climate change action and conversations is the complexity and the depth and the breadth. So we thought it's important to at least take some piece of it today and start there. So we're going to address the two most pressing threats, which are heat and wildfire smoke, knowing that many of the strategies that apply to these issues actually also apply to the other ones, especially in terms of our preparedness and response. So let's jump into heat. So we've talked about that nearly 3-degree rise in average temperature over the past 50 years. And that was from about 58 to 60 degrees average. It's sort of an interesting fact that if you take every temperature reading, night and day, in every part of the world, winter, summer, northern hemisphere, southern hemisphere, equatorial, the average temperature is about 58 degrees. And it's increased to about 60 degrees with climate change. We're less concerned about that middle of the curve moving as we are about the extreme, because what that means is that on the right side of that, you actually see much more heat waves, higher highs, and more extreme events. So how does that impact our health? Our bodies are designed to function within a relatively narrow range, around 98.6 degrees. In fact, if you're above 100 degrees, you're already sort of seeing signs that you may have a fever. So it's a relatively narrow degree. We use clothes when it's cold to stay warm, and we sweat when it's hot. And we rely on evaporation of sweat to keep us cool. So there's your main tip. Our biological cooling system is fluid-based, and hydration is critical. And here are the effects when we're overheating. Because we sweat to keep cool, we become dehydrated quickly. Every body system, every organ, including our brains and our heart and our kidneys, relies on good blood flow and fluids. Another concept that's familiar to you all in holistic medicine. The health impact of heat is around both fluid losses and temperature itself. So we see cardiac stress, general dehydration, cognitive impairment. A hot brain or a dry brain don't work as well. And we see sleep disruption. And in the center, you see heat stroke and heat exhaustion, which is an increase in core body temperature that happens when we're no longer able to control our temperature, which becomes a medical emergency. And while those factors are true for everyone, very young people and elders have an even harder time regulating temperature. As we age, our systems aren't quite as nimble in adapting, and we can overheat more quickly. So here are some of the practical tips for staying cool. And we'll start on the upper left. The first is staying hydrated. Remember, when you sweat, it's salty, like seawater. So if you're sweating out electrolytes, but you're only taking in plain water, there's a problem because you can start diluting your blood. There can be something called hyponatremia or low sodium. This sometimes happens with marathon runners and it's dangerous. So it's good to take in electrolytes for fluids. I usually dilute like a sports drink about 1 to 1 with water because the straight up sports drinks can be kind of sweet. Time your outdoor activities for when it's cooler. Wear light clothing and keep shaded with a hat. You want to avoid sunburn because that actually limits your ability let go of heat. And know the signs of heat stroke. One tip off is that spiral into heat stroke is when people stop sweating, get irritable or confused or dizzy or nauseated. And that merits a call to 911. The other is to know your medication effects. Some of the blood pressure medicines, diuretics, other medicines people may take for chronic conditions further limit your body's ability to regulate temperature. And you should talk to your doctor about whether or not that's the case for you. The next column is tips for preventing this. The most obvious is to stay cool when it's very hot out. If you have air conditioning, use it and stay indoors. But a lot of us in Northern California don't have AC because it's been traditionally temperate, unlike, say, Phoenix, where everyone has an air conditioner as a matter of survival. So we tend to have nighttime cooling around here, luckily. So opening windows and letting that cooler air in at night, and then in the morning, closing windows and pulling blinds is one way to stay cool. Also, remember there are public air-conditioned spaces in most communities, like malls, libraries, movie theaters, and during heat events, more and more places are opening cooling centers. So it's also important in any climate event to stay informed about conditions and resources, and we'll talk a little bit more about that in a bit. And Aparna, what can you add about holistic ways to stay cool?
Yeah, so you were talking about hydration, which I loved, and I also really so happy that you mentioned the hyponatremia piece about adding some electrolytes because not, just free water, tons and tons of it, that drives your sodium down. So, but hydration, sometimes people say, "Oh, Dr. Dandekar, water is so boring. I forget to drink it." And they want to reach for sodas or iced teas, super sugary things. But you can do things that make your water taste a little good, a little better, without the sugar. And some of these are herbal cooling teas and infusions with, for example, mint or hibiscus. These are known in Ayurvedic medicine, at least, to be cooling. And by cooling, I don't mean like they lower your temperature necessarily, like your core temperature. They have cooling energetics. Their bioenergetics are cooling. And so mint is really a famous one. Hibiscus is one. Coriander, which is basically the seed of cilantro. You can even make cilantro water. So you water, place a few sprigs of cilantro in it overnight, and take the sprigs out the next day and drink that water. It's cooling in it. For those of you who like the taste of cilantro, some people don't. It's refreshing. You can do that with cucumbers as well. You could just eat cucumbers. Watermelon is also really in Ayurveda prescribed. Like food is medicine in Ayurveda, so it's prescribed as a remedy for heat and cooling. What we call pranayama, which is breath work, and that can also be there are certain exercise sequences with the breath that can actually cool the body down. And then things like topical aloe vera gel in Sanskrit, we call it kumari. So that is a known plant since ancient times, has been used for the skin and just to cool down the temperature. So that works too. Topical aloe vera gel. You can grow it. It's really easy to grow. In fact, it's nice. It's a succulent. It's a good thing to have in our current climate change. You don't need a lot of water for it. So it's nice to grow. It's something that everyone should grow in their home garden. Really easy to grow here in Northern California too.
That's great. Yeah, and we used aloe vera also for you can get in even the pharmacy for after you've been sunburned. It's one of
Yeah, exactly.
the best ways to relieve that
Yes.
heat.
Yeah.
So one of the key strategies is to stay informed. And the best tool, I just wanted to share with you the tool that I'm using and that we were using in public health in Marin. It's a National Weather Service heat risk map. And this is a screenshot of the map during a heat wave last year. And you can drill in, it's interactive. You can drill in from here into your location. And what I like about this is it offers forecasts 7 days in advance at the community level and color codes them for level of risk, from purple at the highest risk down to yellow. And it adjusts for local factors. So 110 degrees in Sonoma might be extreme at the highest level, but 110 degrees in Phoenix might be one level down because we're not used to it. Whereas in Phoenix, it's much more, they're acclimatized to it and their infrastructure is adapted to it. So it takes historic levels into account. The heat risk mass also, if you click on one of those areas, you can see it, depending on the color, will bring up a set of guidance or tips for for the for that particular level of heat risk. So it's tailored to the conditions. And this will be included in the resource guide that we offer at the end of this conversation. Now on to wildfires. In our part of the world, this runs a close second to heat as an acute climate and health threat. So, as we know too well, the triple threat of wildfires is dry, hot, and windy conditions, those red flag days. And this map shows that we're seeing an increase in the number of days that meet those criteria across the West. And we're seeing more fires, larger fires that burn more intensely and for longer. Wildfire smoke carries substances, a wide range of substances, depending on what's burning. An urban fire like Los Angeles are different than true forest fires. But one of the most clearly understood harms are the tiny particles called PM 2.5 that are smaller than 2.5 microns. And this slide shows the various effects of exposure to PM 2.5, from eye and throat irritation to asthma attacks and emphysema exacerbations, COPD, chronic obstructive pulmonary disease, which makes sense as respiratory effects. But people may not be aware that some of these particles are so small that they can cross after you breathe them in through the lungs and into the bloodstream and cause inflammation of the lining of the blood vessels themselves through inflammation and irritation, causing heart attack and stroke. A recent study published in Nature estimated that wildfire smoke could cause over 1 million excess deaths in the US over the next 25 years with the current trends. But importantly, this is also one of the threats that we have as a lot of control over in terms of our own exposure. And these are the steps to reduce exposure. Remember, the goal of these measures is simple: to limit the inhalation of polluted air. And the good news is there are highly effective strategies. Take steps when the AQI, the air quality index, which we'll talk about in a minute, is 100 or more. And these are sorry, I'm going to go back. So the most simple measure is to stay indoors with the doors and windows shut. You can create a clean air room in your house with a portable air filter. Look for HEPA or HEPA filters, which stands for High Efficiently Portable Air Filter. If you have central air conditioning, the filter should be rated MERV 13. And if you go to the hardware store, you'll see different filters that have different MERV ratings. And the MERV scale is basically related to how fine the filtration is, just like we do with masks. Because we can also carry around our own personal air filter, which is a mask, and wearing a well-fitted N95 type mask when outdoor air quality is poor, the same kind of it has for respiratory virus protection from influenza or COVID, are really useful for filtering out those tiny PM 2.5s. When AQI is greater than 100, it's probably better to avoid exercise outdoors because the risks begin to outweigh the benefits when you're accelerating those particles into your lungs through cardiovascular exercise. And just like heat, it's important to stay aware of air quality. And air quality, unfortunately, is a lot harder to predict a week out than heat, but it is well measured in real time. The EPA has sensors in communities across the region, but not enough of them. Luckily, Purple Air are small, commercially available sensors that measure air quality at your home. They cost around $200 to $300, and we're seeing more and more people purchasing these. And what's helpful for us as a community is that the more people that have them, the more intelligence we have for our community's IQI, because along with the product, the results are uploaded into sort of a crowdsourced way to a public dashboards that allowed to see these with a lot more granularity. And these are some of the screenshots of the outputs of AQI. So what is AQI? It takes into account mostly PM 2.5 concentration in the air. Like temperature, the results are displayed as number and in color-coded levels, with darker colors being higher risk. Green is normal or no risk, up to purple with hazardous conditions. And on the right map, you can see here the readings for AirNow website last week. I just took a screenshot. You can click on any location to get the full numbers. And as a public health officer, and for any of us in our personal lives, we can use these. As a health department, we use them to link our response protocols to AQI levels. For example, local school-based measures were triggered at an AQI of 100 or the orange level. And you'll see more of that as we adapt to wildfire smoke exposures over the next few years. More and more of our policies and protocols will be linked to AQI levels. When fire burns for days, it's hard to prevent exposure. Aparna, as a frontline doc, what do you tell patients if they're being exposed?
What thank you. Yeah. So I tell them, there's really no supplement that makes smoke safe. So the best thing to do is avoid it. But like you said, these fires can burn on for days and spread, and the winds carry the particulate matter far. So for us in California, sometimes it's unavoidable because bad air quality days can go on for a long time, weeks. And so if you have unavoidable exposure, the best thing you can do is make sure you have antioxidant rich foods, hydration, rest, the breathing exercises. There's a lot of them out there. Particularly though, I emphasize the ones that emphasize nasal breathing, because we happen to have, nature gave us a wonderful air filter right here on our face. So use the as I like to tell my patients, the mouth to breathe and mouth to eat, sorry, and the nose to breathe. So yeah, that's important. And then, know when to seek care. Of course, chest pain, shortness of breath, etc. That's where you really need to seek further medical assistance. And then, kids are more vulnerable, so keep them outside at a lower AQI. I think, Matt, you said 100, 150. Is that what you said? And have an asthma response plan prepared. Make sure you have where all your prescriptions are, where your inhalers are, how to use them, how frequently to use them. So have that response plan prepared ahead of time.
Great. Thank you, Aparna.
Yeah.
So helpful.
So here is a chat box question for you guys. Which protective measures have you already put in place at home? For example, air purifier or HEPA filter, a go bag with essentials, heat protection plan, N95 masks, right, that are available readily. And how about none yet, but open to learn, or several protections? You already have this, you're pretty prepared. So I'm seeing a lot of air purifiers in the chat. Yep, HEPA, go bag, N95, a lot of air purifiers. Yes.
I see a lot of all of the above.
Oh
That's
yeah.
reassuring.
Oh yeah, I am seeing a lot of that too. Yeah, there goes another all. Lots of alls. Yeah, very cool.
Yeah,
All
she
right.
mentioned as we're getting these that those models, those predictions around potential mortality around wildfire smoke are based on historical context where wildfire has just emerged really as a threat to public health. I mean, it's been always a threat when we've had events, but haven't had as many events in the, more than like 10 years ago. And so we are learning together what those adaptive strategies are. So those dire forecasts around mortality really presume that we're going to have a lot more exposure than we now know that we can control through these measures we're talking about. People weren't using those clean rooms, weren't wearing masks as much, weren't doing the air purifiers. So we have a chance here to actually mitigate what was forecast in terms of the health impacts by taking these very simple measures.
Yeah.
All right.
Thank you guys. So yeah,
Okay.
Matt, we've talked a lot about like the physical effects of climate disruption, but there's also an emotional um, burden. I know someone earlier sent us a question that we haven't really touched on yet. So I've had many conversations with patients over the years about the emotional burden that we face with climate change, and gives us a lot of anxiety, especially for those with young children or those who are caring for vulnerable adults or vulnerable family members. So in your public health experience, Matt, can you share your what you've learned or what you've noticed?
Yeah. Well, I think any climate change conversation needs to acknowledge the mental health implications. So stepping back, it's important to recognize the stress of having to live with all of this or even having to have this conversation. Um, and one of the impacts on communities experiencing wildfires are mental health impacts. We know that from the fires we've experienced together in California, the Tubbs fire, the LA fire, Paradise fire, Santa Rosa, Napa. And of course, it's not just fire. All the climate threats carry mental health impacts. As this slide shows on the right, the health impacts range from like outright post-traumatic stress, like PTSD for people who are displaced or harmed or who have lost homes or loved ones, to more general climate anxiety from constant awareness and reminders of the trends. Children growing up now, and I have three, and I can resonate with this, have legitimate concerns about their future. So this is a good time to, and this is also, I think, a good time to acknowledge that not everyone has the same level of vulnerability. Climate change is also a health equity issue, um, which has mental health implications also. Migrant farmers don't have the same freedom to stay inside on hot or smoky days, no matter what we recommend, when they're paid hourly for field work and need to put food on the table, and they may not come home to an air-conditioned home. So we also have different levels of exposure. The darkened skies in Marin during the Paradise Fire were obviously disturbing to us, but it wasn't the same experience as those who lost their homes or loved ones directly. And the first thing to do here, I think, is to acknowledge how the feeling of climate anxiety is, in fact, normal, rational, and shared. As parents, we know how to do this for our kids to validate, this is real, but we can do something about it. And in delivering that message, we're also doing that for ourselves. Um,
Yeah, that's a great message of hope, I think, because sometimes it's all doom and gloom, and every headline we read is just so scary. And it's nice to know that maybe we have some control, in our little way to help this. So yeah,
exactly. Because there's, really good literature that one of the best remedies or mitigating factors around stress and anxiety is, in fact, a sense of agency, that we can do something, we can take action, and remind ourselves that we're not helpless.
yeah,
Um, and this is where I go to feel inspired. This is a lot of what helped me feel inspired also during some of those darker days of the pandemic. Um, and if there's any silver lining, it's that the measures we take to build resiliency against climate change can actually strengthen communities, strengthen relationships, and enrich our lives and improve our mental health and social well-being. Um, so we need to take advantage of that opportunity. Starting with getting to know our neighbors, and here are some of those strategies.
yeah. Oh, before we do that,
Oh,
real
sorry.
quick. No, that's fine. Because we're going to come to that. Um, quick poll question, keeping it interactive. Which source do you trust most for credible climate or public health information? So, um, is it local national public health, the CDC? Is it social media, TikTok, Facebook, Instagram, national local news, friends and family, healthcare providers? Whom do you trust the most?
I realize we should have separated CDC out from local public health
Oh yeah, that's true. Yeah, yeah.
these days.
Yes.
It used to be the right question.
So we're just gonna wait a few seconds for the answers to come in. Yeah, I think we can close. Can we close the and let's see what people have said. let's see. So yeah, people have said local, national public health, social media, not that many. Let's see, 1%. National local news, 23%, friends and family, 3%, healthcare provider, 23%. So most are going to local / national public health agencies. Interesting answers.
It's
So
reassuring to see 1% for social media.
I know, seriously. Um, so yeah, we're seeing Matt, a significant shift in public health nationally, and it's becoming an emerging concern. And I think many people here are curious about where to look for climate and public health information. California often leads the nation in awareness on many different issues, climate being one of them. So, Matt, can you speak to what's happening in California and specifically how Northern California can model community level solutions? What's working for us?
Yeah. I mean, building off of, what we were talking about in terms of our collective pandemic response, I think some of these are Northern California, but I think a lot of this is also just generic human community response to a shared threat. Um, and these are some of the specific strategies that have been demonstrated to help us through. One is starting to getting to know your neighbors. It seems simple, but there's some really good evidence around this. And I'll share an example from Chicago. In the Chicago heat wave in the 1990s, there were about 700 heat-related deaths in a week. It was like an unbelievably hot week. There wasn't a lot of this is, before we had as the same level of infrastructure now we have in terms of warning systems and responses. 700 people died in a week. It turns out one thing stood out as an overwhelming risk factor for death. And it was probably not surprising to you. It was social isolation, heartbreakingly, particularly older people living alone in apartment units in the city without air conditioning and who didn't have people to check in on them and didn't reach out. None of us can face these challenges alone. So we're seeing an emergence of clubs, schools, faith-based congregations have set up phone trees to reach out to vulnerable members when we're seeing a climate event. You can also join neighborhood resiliency groups. One kind is called CERT teams, and they have them throughout Northern California. Community emergency response teams. They can help people set up go bags with essentials for any evacuation event. You can also protect your neighborhood by hardening your home against fire. And you can share resources, remembering our best resource is in fact one another. You can give a ride to a neighbor, to a cooling center, or invite an older friend into your air-conditioned place for a few hours. There's no way that government can get to everyone all at once. So really, when it comes to especially an extreme weather event, that network of community supports really ends up being operationally the most important layer, and it has to be defined and led at the community level. There is also, from a government standpoint, more formal infrastructure emerging to support. Here's what a cooling center looks like. It's not fancy. Across Marin, we set up cooling centers. They're just a place with air conditioning, with enough places to sit that's open to the public and accessible. Here's a picture of a community gathering to plant trees to reduce heat in urban areas and generate some oxygen while building community. And on the right is another resiliency hub, which offers support. They're like cooling centers plus. They offer support in any extreme weather with safe physical space, as well as serving as a resource hub for other public services like CalFresh enrollment or health insurance or even health screenings. And my kids actually volunteered in a setting like this during a storm a couple of years ago where they served food and really got a lot out of that experience. So we've talked a lot about kind of mitigation or adjusting to the health impacts of climate change, but we shouldn't see them as all inevitable. As we said, greenhouse gas emissions are the primary contributor to global warming and climate change. And this slide shows the primary contributors to greenhouse gas emissions in the United States. So we're going to talk briefly about actions we can take to prevent some of these threats. And as we do that, I want you to pay attention to something cool here. Many of the steps that we take to protect our planet are in fact things that protect our own health directly. So there's a win-win strategies for planetary and personal health. Just as we saw that some of those community resiliency strategies actually build social bonds and community cohesion, another win-win. So let's start with transportation. It's the highest contributor, about 28%. So here's some climate actions that you can take. Most car trips are less than 3 miles. There's some great studies by a guy named Neil Maislich, who's an epidemiologist out of UC Davis, that showed that if we just exchange these small car trips for walking or bicycling, so active transportation, we would not only reduce greenhouse gases, but extend life expectancy by advancing cardiovascular health and our mental health and anything else that exercise benefits. And I have not yet seen any condition, any health condition that exercise doesn't, whether it's cancer, mental health, whatever it is, moving and being physically active, even at any level, is almost universally seen as beneficial, unless it's a musculoskeletal injury that needs rest. We can also use public transportation and carpool more. We can use, my wife and I both have e-vehicles now, and we love it. It's amazing to drive past gas stations as if they're like totally irrelevant. And I never realized how, no one had told me how like much fun I thought it was something I was doing, sacrificing, for the sake of the environment. It's actually a much funner car to drive. It's super sporty. They have no tailpipe emissions, lower operating costs, and there are federal and California tax incentives. And every day there are more and more charging stations. Aparna, I know that another win-win, an interest of yours is in dietary health. Can you take us through this?
Yeah, I prescribe an Ayurvedic diet to a lot of my patients, and which is largely plant-based. So, and that can be daunting for some patients. They don't want to, hey, I don't want to be vegan. Are you telling me to be vegan? No, it's not that. But just if you can reduce your meat consumption, that would be a huge help, not just for the environment, but also for you, like personally, that animal protein, if you can reduce some of that. And you could do that. You could do like a meatless Monday, or you could just cut down and opt for more plant-based meals. You don't have to go completely vegetarian or vegan, but that's something that I often recommend to patients. Yeah.
Great. And another thing I guess that you asked about Northern California kind of specific or California specific assets. We're fortunate to have a growing season around, where we can actually, like our farmers markets are great for locally sourced foods. And that's another win-win because we're supporting kind of local growers, the local economy, obviously more nutrient-rich foods, less greenhouse gases associated with transporting processed foods long distances. So that's another, I think, asset is our farmers markets all across our communities.
We're lucky. We're really lucky.
So here are just some of the numbers associated with some of those measures that we just described. E-vehicles can reduce 4 to 5 tons of carbon dioxide. Reducing meat consumption is another half a ton. Active transportation, there's another ton of carbon dioxide. And then less, like even just taking one fewer round trip cross-country flight is another ton of carbon dioxide. All ways that we can feel empowered.
So, chat box questions. What is one action? And the chat is open now. What is one action you're ready to take in the next month? For example, are you going to get an air purifier or prepare a go bag, or do you have a heat protection plan? How are you going to reduce personal emissions? Is that something that you'd like to do in the next month? The strategies that Matt just talked about. How about talking to family or neighbors about preparing together? Getting involved in community climate action, taking care of mental health around climate stress. I'm reading your answers. Yeah. That's great. Yeah, I'm seeing a sprinkling of everything. They're all good answers. I in my neighborhood, I have grown kids now, but when we were when they were little, we had block parties. We still try to do them every year. And we would call in the local fire department. They would come with their truck and they would give us a talk about preparing our go bags, and we'd often, come together and compare notes, and the fire department would talk about, exit strategies, evacuation routes, what to plant around our houses. So it was really, really fun. And with the fire truck there, it was really fun for the little kids too. And so it kind of got them this message sort of implanted um, in their little minds while they're having fun eating and running around and looking at the fire truck. So that's what we did. Yeah, I'm seeing a lot of answers for all of them. Drought, mental health, drought tolerant plants. Yes, great, great answers.
I love the e-bikes. I should have mentioned that.
Oh yeah.
That's a nice hybrid strategy between an e-vehicle and a bicycle.
We
Um,
love our e-bikes too, because you have to sort of you can get away with pedaling less.
yeah, yeah. There was a New York Times piece on e-bikes. The Sunday, um, New York Times Magazine was featured e-bikes, and Marin County and I was heavily quoted in that piece. And I was a little worried that it was casting shadows on e-bikes because it was a safety focused. But by and large, e-bikes are a really positive trend, and really help, especially as we get older and it's harder to get up the hills in our California areas. So I'm strong. Next talk like this, I'll add e-bikes to that slide.
I'm
All
seeing a lot
right.
of that in the chat too. Yeah.
Legal e-bikes, please. Thank you, Al.
Legal e-bikes.
All right. So I'd like to end with just leaving you with some reliable resources. We know that the information landscape is increasingly confusing, and the CDC is dismantling websites related to climate change, and there's been kind of more polarization of this topic. Some of the resources that we've looked at together today are here just in one place. If you want to take a picture of this, or these will also be included in the resource guide that's sent out after this conversation.
And if you guys, oh yeah, if we could, well, that last slide showed your local epidemiologist. So Matt authors that weekly. He has a weekly article that he does. So wanted to put that in there too. Mention it.
Yeah, yeah. I mean, since stepping away, it's been about a year since I stepped away from my role as public health officer. I've been dedicating myself to climate research and to public health communications. I kind of recognize that um, as my career as a 12 years as a health officer, recognize more and more how important just giving people the tools they need to navigate decisions they're facing in their everyday lives is probably the most important thing public health could be doing, and then providing resources and supports for those decisions. So to do that, I've partnered with my friend and colleague, Dr. Caitlin Genlina, who founded YLE, your local epidemiologist, during the pandemic. And it really emerged as one of the leading sources of public health information. She's been advising the CDC and the White House. My guiding principle is to offer timely, evidence-based, and useful information that's relevant to communities in sort of in a personalized and accessible way, and trying to be as balanced as possible with all the polarization that's out there. So it covers a wide range of topics, including climate change, and it's free. There's a QR code there that you could scan to register. And we have support from California Department of Public Health and the Robert Wood Johnson Foundation.
So some key takeaways. Climate change is very much affecting our health today, our physical and mental health. The good news is we have tools to protect ourselves. We are stronger together. That sense of community is really key. As that example that Matt gave about the people in Chicago who perished, we need each other and we can model solutions. So Matt, would you like to share any concluding thoughts before we really get into the pre-submitted questions from our audience?
I think just that it's easy to feel overwhelmed by all we're facing with climate change. I hope that you're feeling a sense of some sense of agency or a glimmer of hope that there are steps we can take. It's something we're all going through together. And just being here shows that you're already part of the solution. This will be an ongoing and evolving issue for us. And the key is to stay connected and engaged so we can all respond. We need more conversations like this. So again, thanks to you all at Sutter for setting this table. And thanks to you all for being so engaged in this conversation. I'm excited for any questions people might have. Oh, and this is my son. This was just before the pandemic. He's now a high school freshman and is taller than I am. But this is him at the Rosie the Riveter Museum in Richmond, um, kind of reminding us that the work we do together is not just for us, but it's for the next generations and all the generations to come.
And
Thank you.
he's so adorable. We received a good number of questions from the registrants pre-event, many of which helped guide today's discussions. And we're going to answer some of the most commonly asked questions that we have received, and then we'll open up to our Q&A. So if you have any questions for us, we invite you to share them using the Q&A icon. So first question I'm going to ask, Matt, is in your time serving as Director of Primary Care in the Navajo Nation, what local ancient therapies did you find the most effective?
Yeah, I love this question. I mean, it did mention some of the corn pollen, but I think it was actually rather than a specific product, the healing rituals themselves were the most impactful. Navajo traditions see illness often as a sign of losing connection with sacred things, with ancestors, with family, with tradition. And healing is often in rituals that are all basically putting the person at the center of a highly intentional act of people coming together to kind of restore that connection. And I saw how healing that was just by observing and learning. And one ceremony really stood out. One of the first I observed, which involved placing a young man who was struggling in the center of a circle of people who were loved by that person and who loved that person. Um, And they each approached him and literally pinned something meaningful to his clothing, like
Mm.
a photograph or a dollar bill or a sprig of sage, something that sort of represented their wish for that hope. Um, so at the end of the day, that person was actually like wearing the love and the wishes of everyone around them. And it's something I kind of felt like we really need more of that kind of thing when I think about my own kids and adolescents and all they're struggling with these days. And those kind of ceremonies were so important that we incorporated traditional healers into the hospital, into the wards, um, and had to do things like sometimes cover the smoke alarms for certain smudging ceremonies so they didn't go off, but really finding ways to make sure that traditional healing practices found their way onto the wards. There's a beautiful blend of biomedical and traditional models that I learned a lot from.
Great. That's beautiful.
Oh, sorry.
So, I can take this one. Advice for falling asleep and staying asleep in the excess heat of summer. It's hard even with a fan or when wearing cotton. So, I can sort of answer this from an Ayurvedic perspective. Once upon a time when sandalwood was abundant, because you'd have to cut down the whole tree and you'd get to the heartwood of it. So you couldn't just take off a branch, you'd have to cut the tree down. It got harvested to, it's endangered. But once upon a time it was abundant. And when it wasn't over harvested, an old Ayurvedic remedy was to put a paste of sandalwood powder and water, and it's really fragrant, and put it onto the forehead. And that was a nice solution to cool the body down through evaporative cooling, and just the smell of it, the aroma of it was one way to fall asleep in excess heat. But a low-tech solution, since not all of us have access to sandalwood, would be to use a cold compress directly to the forehead. So there's research out there that it cools the frontal lobe. There's all sorts of stuff that they're saying, but it's low tech, and for many people, it works surprisingly well to fall asleep. So you can even, get these they're sort of like pre-sewn. They have these beads in them that expand when you soak them in water, and they stay cool. You can put those around your neck, but you can also put them on your forehead too, I find, and that really helps you fall asleep even if it's really hot. It cools the head down, and in Ayurveda that was a remedy, and now in modern science they're finding that that works. So, good question.
Thanks, Aparna.
Okay, I'm going to read the next question. As the world warms, which sounds like as the world turns, that old soap opera. As the world warms, I digress. Is there a concern that various rare microorganisms will flourish and negatively impact our health?
Yes. I think, it would be naive, and I think we make this mistake sometimes to assume that the factors that are affecting our own health are not also impacting every other living organism. And obviously, our Gaia is such a complex and interdependent system. We don't always know exactly how the microorganisms are going to respond, but I think some known threats. The biggest factor I see is or a great example of this issue is the northern migration of what were so-called tropical diseases, especially those carried by mosquitoes. They're tropical diseases, mainly they're equatorial, mainly because of the temperate climate in tropical areas, and it suits the habitat of those vectors that can carry diseases. So as the world warms and we had that 2-degree temperature rise, they move north because they're able to live further and further into northern climates and southern climates. So the biggest factor, one of the things we're seeing is mosquitoes. Mosquitoes are common carriers of vector-borne illnesses, dengue fever, yellow fever, malaria, etc. And we're starting to see more what we call endemic spread of those diseases in places that hadn't occurred before, like dengue fever, carried by certain kinds of mosquitoes that used to be, um, outside of the US. And now, as temperatures rise, we're starting to see more cases, even in California. There's other examples. Toxic algae blooms, algal blooms that we've experienced in some parts of just off the coast in Marin and Sonoma County, some of the ponds that had these toxic algal blooms where pets that had gone in and ended up actually becoming very sick. Um, so we need to stay vigilant about recognizing these threats, and our clinicians need to be aware in terms of our differential diagnosis as people come in with symptoms to consider them. And also importantly, from a communication standpoint, to link these occurrences when they happen, when we see a case of dengue fever that was locally acquired, to explicitly describe it as a consequence of climate change so that people understand what's at stake when it comes to taking policy action. And that's part of my research is providing these kinds of forecasts so that we have our eyes wide open to the full range of consequences of climate change.
Okay, what can we do to detox air holistically? So, it's a great question. I think an easy way to scrub indoor air, as we mentioned, is to get a good HEPA filter for fine particulate matter. And that's great, but there are other pollutants in the air like VOCs, volatile organic compounds. They're off-gassing from like drapery and furniture and paint. We also have ozone, which is good when it's up there, but when it's down here, um, on the surface of the earth, it creates so it comes in from outdoor smog. It's part of smog, but it can come in through our doors and windows. But it's also coming from indoor sources like copy machines and laser printers. So for these pollutants, house plants, and I saw some of you asked that earlier, house plants such as the snake plants, also known as mother-in-law's tongue, spider plants, they work really, really well. You need a lot of them. Just like you can't just have one or two. You need to have them all around the house. Now, I'm thinking of my house growing up in like the 70s and 80s where everyone macrameed, and my mother was no exception to the rule. And she had all these macrameed, a gajillion plant hangers, and we had spider plants all over the house. So I don't know, some of you probably remember those days. But yeah, a lot of house plants, particularly the ones I mentioned, were the ones that were studied, but I would assume houseplants in general would be good for you if you can't get those particular plants. So yeah. What can we do about, this is one we get a lot. What can we do about microplastics in our bodies? And is there a test or treatment?
Yeah,
Matt, what do you think?
yeah. Um, we thought about including microplastics as one of the topics in this conversation and recognize that it's not climate exactly per se. It is definitely related to climate in that it is a consequence of the same kinds of drivers that are leading to climate change, which is overconsumption, and commercialization and the effect that that has on our environment. But it really does deserve its own conversation. I've been looking into microplastics from a research standpoint, and I'll just quickly summarize where I landed on this. There's a lot we don't know about the effect of plastic exposure, but we do know that plastics don't break down like other materials, and they just form smaller and smaller particles. And with almost 1 billion tons manufactured annually, it's accumulating in our environment like a kind of new kind of dust or modern dust is how I think about it. And it's making its way into our bodies. My mental model for how microplastics impact our health is primarily through inflammation. There have been good studies that show these tiny fragments of plastic in our blood vessels and most organs, including in our heart and brains. And every month, it seems like there's a new study coming out that's describing the presence of microplastics. While it's not exactly clear that they cause those diseases, my opinion is they probably are, in terms of the increased incidence of Alzheimer's and other forms of dementia and heart attack and stroke in people that have those inflammatory markers. Um, and as it relates to higher concentrations of microplastics in our blood vessels tend to correlate to worse outcomes. Um, the best way they gain access to our, so think about how they gain access to our bodies, mainly through what we eat and drink, and to a lesser degree for what we inhale, and maybe trace amounts through our skin. So the best way to limit exposure is to limit contact between what you eat and drink and plastic as like the single most important step, and something we're doing in our own family, especially heated plastic. So in our family, we don't drink any water out of plastic water bottles. We try to avoid food packaged in plastic products, and we definitely don't microwave food in plastic because heat accelerates the degradation of plastic into what you're going to consume. Um, so it's an important topic in itself, and we're still learning a lot. Starting soon, you won't be able to get plastic bags, so there are steps on a policy level that are being taken to protect us, and California is on the lead of some of that. So that question of plastic or paper will become moot for us. Um, so California policymakers are starting to step up to reduce our exposure, but I think this is something we all need to be part of a learning community around, and addressing this emerging problem together.
All right, what kind of furnace should be used? Now, it's had one eye in the chat, trying to keep one eye in the chat, one eye in the presentation, and saw interesting answers. What kind of furnace? As someone mentioned in the chat, one of the best ways, there are many innovative ways, first off, to heat and also, I will add, cool our homes, but the old-fashioned heat pump, some of you mentioned, is making a comeback. And these things, these heat pumps help keep the house warm in the winters and cool in the summers. And if you happen to live in an arid part of the country, then swamp coolers, again, like low tech, is sometimes the best. They are relatively more energy friendly. I mean, you do need energy to operate the pumps and the pumps in both the heat pump and the swamp coolers, but still your energy consumption is far lower than a giant furnace or an AC unit. So yeah, great questions, everyone.
Thank you, Dr. Willis and Dr. Dandekar, for that great discussion. I learned so much today. Thank you so, so much. You can follow Dr. Willis on his weekly California edition of your local epidemiologist newsletter. And remember, your health education doesn't have to stop today. You'll get an email with the slides and resources in a few days, so you can access the tools that were shared. You can also subscribe to our free monthly newsletter, Inside Healing, to get regular updates from us. So each month you'll receive wellness tips and videos, updates on upcoming events, and information about Sutter IHH Care Centers. So you can scan the QR code, click in the chat box to subscribe. You can also follow us on social media to stay updated. We're so happy you joined Sutter Health Institute for Health and Healing event. Thanks for participating. I would like to thank our wonderful guests, Dr. Matt Willis and Dr. Dandekar, for this wonderful discussion on climate change and your health. I've some really insightful resources and actions that you can all take. Just a reminder, our clinics are in 5 locations in Northern California. Our QR code gives you the link to our homepage where you can learn more about us. And we are so grateful to our generous donors who make events like this possible. Without their support, we wouldn't be able to do all the wonderful community programs that we have at the IHH. To donate, please use the QR code, our website, or there's a link in the chat. And again, today's lecture will be available for replay on our YouTube channel. You will get an email with the link to view and share with your friends and family. If you'd like to learn more about the Institute for Health and Healing, visit our website, myhealthandhealing.org. And remember, you will receive a survey once you exit the lecture. We really do read each one, so please let us know what you think. Thank you and have a great day.